Welcome back. From diagnosis to treatment, our next guests are dedicated to providing exceptional and advanced care for chronic wounds. Joining us now to chat about their specialty, the wound care clinic at SAAK Health, is Dr. Priya Asija, along with Tiffiany Vazquez, a registered nurse for wound care and hyperbaric therapy. It's great to see both of you.
Thank you for having us.
Thank you for being here. Let's talk about some of the common reasons that someone might visit you. What types of problems do you see most often?
Likely more chronic wounds, diabetic foot ulcers, osteomyelitis, which is infection in the bone, and compromised flaps or skin, radiation injuries for hyperbaric oxygen therapy, and also non-FDA approved indications for hyperbarics.
Okay, so it's interesting you mentioned radiation wounds. So that would be somebody who's had treatment for cancer, for example, and they've had radiation. It's really hard on the skin, isn't it, those types of treatments?
Yes, and they can cause local tissue necrosis, which causes local tissue injury, and that hyperbaric oxygen helps them.
I've visited you before at SAAK Health. I'm so impressed by the clinic that you have there, and you work with several other specialists in very specific areas, cardiac as well as women's health. And one of the things I notice is that the people are so able to easily access a specialist like you. It must make you feel good as a practitioner that people can easily park. They can make an appointment, they can see you, they can have advanced treatments, specialty treatments right there at the facility.
It's an accessible clinic with multi-specialty approach, and it helps us see the patient faster and give quicker results.
Which is so wonderful. Tiffiany, I want to talk to you a little bit. I bet a lot of the patients that you see at SAAK Health are people who've had wounds that seem resistant to healing and that they're sort of not resolved, right?
Yeah, definitely. Most people are sometimes frustrated that they've been dealing with this for so long. So we really try to take our time to educate them on what our approach is going to be and how we can help them resolve it in a timely manner for them.
I also think about, we've talked about the stigma before, doctor, and I think about people, you know, how they feel emotionally and mentally about these wounds that are sometimes visible to the public or to their friends and family. That's part of what you do too, is helping people through that.
Yeah, restoring self-confidence in these people who are dealing with this kind of wounds. They are not pretty to look at. They smell. They cause embarrassing drainage from the wound, which is they cannot go to a family get-together because the wounds are festering or they smell. So our approach is to have a human touch to this and to help them heal them.
The compassion component is something I really noticed when I met you, as well as the other specialists who you practice with. I bet a lot of people wonder, because we want to talk about the hyperbaric therapy, I bet a lot of people wonder about insurance coverage.
Yeah, most of the insurance, Medicare, Medicaid, all private insurance do cover hyperbaric oxygen therapy.
It's so wonderful that you have that to offer, because when I was there, it was brand new. In fact, I don't think you'd had the chamber there yet, but you had the setup for it. You were sort of waiting for it to be in place. This has got to be exciting to offer again on your location, on your premises.
Yes, and we are starting our hyperbaric oxygen therapy treatments in the first week of January 2025.
Good for you. That's so exciting. Do you have people actually call the center asking about hyperbaric treatments?
Yes, a lot of interest, a lot of people wanting to get on that list to get started to get their treatments. We're very excited about it.
Oh, I bet you are. How does it elevate what you can do? What does the hyperbaric chamber do for you that you maybe can't do in some of your other more traditional, conventional treatments?
So hyperbaric oxygen therapy is giving oxygen under pressure in a hyperbaric or a closed chamber. So what hyperbaric oxygen does is it decreases the tissue swelling. It decreases the tissue swelling. It breaks down the cycle of oxygen starvation, tissue swelling, and tissue death. So that's what it helps.
Does it also increase blood flow to the area? So it decreases inflammation, while increasing blood flow.
Right.
But that oxygen really has a way of penetrating the wound, it sounds like.
It does, because if you have a wound, you are thinking about bacterial infection in the wound. So all the oxygen has been taken by that bacteria. So this extra oxygen added to the tissue will help them get rid of that tissue damage or necrosis, and will help them heal faster.
I was just going to say, do they have a resolution sooner? And that's exactly what you just said. This is exciting stuff for you guys. I love having you here on the show, and I feel like you really have a calling to do what you do in wound care, both of you. Thank you so much for being here. A pleasure to meet you too. Appreciate it. Thank you,
Thank
Doctor.
you for having us.
Thank you.
Absolutely, and happy holidays to you guys.
Happy holidays.
Thank you. And not all wounds are the same. Keep that in mind. You can visit SAAK Health for personalized treatment for your wound. The medical professionals there want to remove the stigma that's associated with wounds and wound care. They are located on West Capitol Drive in Brookfield. It's brand new. It's beautiful. And for more information or to book an appointment, here's the number to call. It's 262-444-5148 or visit SAAKhealth.com in that hyperbaric chamber. Treatments are starting in January.